Hello and welcome. You've tuned in to Health 360. On the show this week, in spite of a lakh crore plus being allocated on health, why are 50% of Indians not availing of government facilities? Also on the show, how does cutting the cost of 17 cancer drugs help cancer patients? Is India now doing the groundwork to lead in research and development in the field of medicines after consolidating its position as the pharmacy to the world? Also, an AIIMS study suggests depression can be detected through sound. We're also going to be telling you about the unseen dangers inside our own homes that could be raising cancer risks. I'm Sneha Mordani. This is Health 360. Well, the week gone by, we commemorated World Cancer Day. The WHO, the World Health Organization, says 4 in every 10 cancers are preventable. Some are known causes of cancer, some are silent chemicals lurking around your house. This report puts the spotlight on the silent causes of cancer and endocrine disruptors. The World Health Organization says that 4 in every 10 cancers are preventable. You don't smoke, don't drink and live in a clean environment. Of course, you've reduced your risk. But what else can one do to cut down their risk of cancer? Well, I'll tell you. The thing is, if it is in your house, it's in your body. Start with scratch non-stick pans. They release toxic chemicals when heated. Thrash them.
So see, all these Teflon coated and any artificial coating over any cooktop, what happens gradually is they lose that coating. And from those coatings, you have those compounds which is known as, forever chemicals. So it's not like that if you have cooked it one time and the next day you are going to get cancer. No, it is going to be a long-term exposure of long-term peeling of that particular Teflon layer, which causes this particular problem.
Next, plastic food containers. Heat plus plastic equals chemical soup. Throw them out.
If we are using plastic which has BPA, and if we are especially heating some, let's say some drinks, some coffee or water, then it becomes very harmful. Non-BPA alternatives are there. Non-BPA food grade plastic products are there, which are usually considered a safer option. Or else, again, as I just mentioned, glass bottles are perfectly fine, stainless steel or copper. These things are, if they can be used, that is the best thing.
Air fresheners and scented candles, they don't clean the air, they poison it.
For scented candles, you have the compounds like benzene, formaldehyde, toluene. These are those compounds, which are generally linked with the leukemias and the blood cancers. If you have repeated exposure to the scented candles, that means every day in and day out, you are getting exposed to these, abnormal, harmful perfumes. Your body will start to mount an oxidative response towards them. And once that response outweighs the body's immune mechanism, then obviously you are going to land up with the abnormal cells and ultimately cancerous generation.
Harsh cleaners and bug sprays under the sink. Designed to kill, why keep them?
All these chemicals, we can inhale them because they are continuously being released in the air, and the person who is exposed to them constantly on a long time, they can, again, on the same logic, the chemical get inside the lung, irritate the lung, and it can lead to cancerous changes inside the lung on repeated exposures. So not harsh chemical based things should be used. We can go for light or herbal things. We can, soda and vinegar solution is one, or mild chemical based.
An old makeup and personal care products, expired, hormone disrupting, dangerous. Toss it.
At any point, if you have old makeup products, so the carcinogen, the active compounds become inert and it starts to accumulate inside that particular, product. So that's why every beauty supplement or beautification you can say product comes with a label of expiry, and we are now an educated class. So why can't we be aware about self? That before buying, always look for the expiry, and if something is expired, why are you even using it?
Cancer risk isn't always loud. Sometimes it's hiding in your kitchen, your bathroom, your air.
Development of cancer is a very long process, right? And these products, these chemicals, they can speed up that process. So that is why repeated exposure of any harsh chemical we should avoid. Preferably, we should be using more of steel in kitchen, more of glass bottles for drinking, rather than using other synthetic things, because they can still be harmful.
Safer alternatives are always there. We only have to identify them and be more open to these options.
So safer alternatives. Number one, use plastic as much as less possible. Use ceramics. Use glasswares whenever possible. Avoid excessive heating of plastic in microwave because that can cause leaching.
So if we talk about safer, so anything which doesn't have plastic is a good option. Preferably cast iron for preparing food. For storage, I think we can go for steel or glass-based containers or bottles. They are perfectly safe. If at all we have to use plastic, use non-BPA containing food-grade plastic.
Biopharma Shakti stands for Strategy for Healthcare Advancement through knowledge, technology and innovation. The Government of India is funding it with 10,000 crores. It actually is a national initiative aimed at transforming India into a global hub for biopharmaceutical manufacturing, research and innovation. This, remember, will eventually reduce dependence on imports and enhance access to advanced therapies. We decode. A big ticket announcement, this budget was a whopping 10,000 crore allocated to the government's Biopharma Shakti scheme. So what is this scheme and how does it really add to India's position as the pharmacy to the world? Simply put, this is more money being spent in research funding. It aims to push India beyond generics and position it as a global hub for innovation.
We are very pleased to, as you have mentioned, that there is a 9% increase in the overall health budget. However, the importance of research, particularly health research, is very obvious by the fact that the increase from last year is 24%. We have had a 24% increase in just 1 year, and it has been the research budget has doubled in the past 3 to 4 years. And this shows the commitment of the Government of India to innovation and to make sure that the health sector innovation in science and technology will contribute not only to Viksit Bharat, but also make India a powerhouse, a global powerhouse for research.
Experts say increase in health research funding is far more striking than the overall budget rise.
And India has been doing fairly well in the biopharma sector. We have been doing very well with generics, very well with biosimilars. However, again, to make new biosimilars and to make new indigenous products that are not even copies of anything globally available, we need to invest in research and development. And we need that Indian industry as well as Indian academia work together, and both are encouraged to do this kind of development. So the Biopharma Shakti is going to put together the power or the Shakti of all these different players together.
So why is this move futuristic in many ways?
Of course, this will be the future because in our country, the non-communicable diseases are growing. So, non-communicable diseases means this diabetes, obesity, cardiovascular disease. Majority is cancer drugs. So, cancer are growing. So, most of the cancers and the non-communicable diseases are treated by biology, biopharmas. This is monoclonal antibodies. So by that only we are treating majority of the cases.
And what is India's potential?
There are hundreds of bioproducts are getting off patented in another 5 to 10 years time. So India has the potential to manufacture those hundreds of drugs internally in-house. So it will increase our economy and it will be easy for us to treat the patient at the lower cost. This will be very helpful for us. And this is the future for next 5 to 10 years.
Why is R&D so important?
So it is important to improvise this, more people coming in, doing this research, doing this study, the clinical trials, which are very important. A lot of our pharma companies goes to China to find out what are all the new molecules available for the cancer treatment and other diseases treatments. So our companies are going and asking China what are all the new molecules there, so we can import it and use it in India. But that will be definitely reduced. So that's very important. So we should have our own. To have our own, we need a lot of talent also on our own. So this is the right time. We can start now. Maybe in another 5 years time, we'll get the right benefit we can enjoy.
India has allocated 1 lakh crore to health in the budget. But in spite of this, 50% of Indians are not using government health facilities. And there is little trust and reluctance to use these services. Why so? We report. 1 lakh crore plus, that is how much has been allocated to health in the budget this year, a 9% increase. Do you know the last time India allocated 1 lakh crore was when we were in the peak of the pandemic? But I had to ask myself this, ye paisa aakhir jata kahan hai? Why isn't there an improvement in services even optically? Why can't we see public health service get better? And why are 50% Indians still only trusting the private sector? Well, the answer may lie in this: staff shortages and poor utilization of funds.
You just cannot build a hospital by building a structure and say calling it a hospital unless and until you staff it with the required nurses, paramedical staff, doctors, specialists, super specialists. This happens because the money is being spent in physical infrastructure rather than in staffing it with proper people who will be able to run the show properly.
Think of it, over 1 lakh health centers have been upgraded, 157 medical colleges approved, but most people aren't using them.
See, it is not correct that people are not using to the public hospital. If there are good public hospital, people are going to that. It's important the government should invest more and more in the medical college, in government medical college and the public health system so that people can get access to there.
Now in the year 2022-2023, only 65% of allocated National Health Mission funds were spent, declining further to 62% in 2024-2025 as per a January 2026 analysis by the Foundation for Responsive Governance.
The funds which are exclusively for health and education, the 1% out of says 4% says health education sin, 1% was for the health. If you see from as per the CAG report 2025, there from 2018 to 2021-22, the amount which is collected from in the name of health says it has been not transferred to the public account. The entire money is going for the insurance schemes and the other schemes.
Here's more. For health and wellness centers, only 40% of allocated funds were spent in 2024-2025. Another analysis has found.
We have faced a problem with utilization and transparency, not currently, but for all possible period that we can remember. There should be real-time tracking of funds, staffing, and patient outcome. That is, we should, as individuals or as citizens, know where the money is being spent, how much money was spent for each particular activity, where is currently that money which is being spent, how is it being used, how is the project running, and how soon will the project achieve finalization.
India's public health infrastructure remains overstretched. India's community health centers have an estimated 80% shortfalls in specialists, meaning only about 1 in 5 surgeons, physicians, gynecologists and pediatricians is actually in place.
Because there are long waiting times, there is a poor experience, there is lack of specialists, and most importantly, the quality is inconsistent. If you go to the senior most person in the department, you may find one of the best doctors globally as far as reputation and expertise is concerned is available. But at the other end of the spectrum may be somebody who is improperly trained, who's not properly guided about the various procedures, and the experience with that particular individual may be very poor. The infrastructure related to cleanliness, sanitation is very, very poor.
Millions of Indians who need imaging studies or specialists actually end up spending more money to reach district hospitals, increasing the burden at the tertiary care level. What about the doctor-patient ratio? In 2022, there were 7,908 people per government allopathic doctor, 8 times higher than the World Health Organization's recommendation as per the analysis by Rescov, and in 2023 India had 1,666 people per government hospital bed. But when it comes to minimum standards for infection control, diagnostics and patient safety, most public facilities are found wanting. What about out-of-pocket expenditure? Now, for every rupees 100 spent on healthcare in India, rupees 60 is being spent by the government. 17 cancer drugs will become cheaper under the budgetary announcements. Why is this move important and much needed? What does it really mean for cancer patients? Let's tell you more.
To provide relief to patients, particularly those suffering from cancer, I propose to exempt basic customs duty on 17 drugs or medicines.
A round of applause from MPs and health experts alike. 17 cancer drugs are exempted from customs duty, bringing in much needed relief for family members of cancer patients and to the patients themselves. The immediate impact: cut in prices of these very expensive medicines. Imported cancer drugs in India attract a basic customs duty of 10%. Some categories of life-saving drugs and vaccines attract a concessional rate of 5%, which has now been made zero for these drugs.
So these are the new generation of drugs which are immunotherapy targeted medicines, and these drugs were previously not accessible to our patients because the cost was high. Now with the decrease in excise duty, the affordability of these drugs would increase. So many more patients who who could not afford these drugs previously will have access to these drugs, and I can see that there's a lot of precious lives which can be saved. Like for example, melanoma is a disease of younger patients. So and these are protective age group. So that is why this is a very welcome step, and government has particularly chosen those 17 essential drugs which make a lot of difference in cancer control.
Cancer is a major and growing public health challenge in India. The disease imposes catastrophic health expenditure in India, with medicines constituting more than 60% of out-of-pocket expenditure.
If I find a mutation and I use this drug, so the cancer control is much better, the survival is much better. Secondly, my use of toxic treatment like chemotherapy, radical surgeries become lesser. The surgery becomes precise if needed. So not only we increase the survival, we also de-escalate the toxicity of cancer treatment. And this is the kind of, when we say it's a precision technology, so precision medicine. So we are able to identify why the cancer has happened, and we nullify the reason why the cancer is happening through this drug.
cancer drugs. Very, very expensive medicines in the country will now become cheaper by removal of duties. Talk to us about that move. Why was that absolutely essential? Also, exemptions given for diseases medicines for rare diseases, which again are very expensive in the country.
So to me, this reflects the empathy and the thinking of the government of India, led by our Honorable Prime Minister, to make sure that people who are suffering, who are unfortunate to suffer from diseases like cancer and these rare diseases, for which there are medicines available outside India, but somehow for these conditions, if we do not have those medicines which are made in India and we have to, unfortunately at the moment, import them, it is to help those people to think about equity, to think about the financial pain that those people are going through, and to make sure that the citizens of India are helped by the government as much as possible.
Delhi's All India Institute of Medical Sciences has now come up with a research that indicates that the tone of a patient's voice can actually be a diagnostic tool in depression. Speech analysis combined with artificial intelligence is changing healthcare in many ways.
पापा, मैं कहानी सुनाऊं? हाँ?
सर,
सच भूल गए हैं जूते कहाँ उतारे थे।
वो सचमुच ये मानती है कि अगर वो घर से बाहर निकली तो वही होगा जो उस रात हुआ था।
I have begun therapy. Yes, मैं दिमाग के डॉक्टर के पास जा रही हूँ। तो अगर आप मेरे पीठ पे से मुझे पागल बनाने वाले, just say it to me right now. Sit on my face.
What if your voice could reveal what your mind is going through? Researchers at AIIMS in Delhi say it just might. Depression doesn't only affect how we feel, it affects and changes how we speak.
तो क्या है ना? I'm not okay with ये दुनिया जहाँ ऐसा होता है.
Slower speech, flatter tone, less energy, subtle signs most people miss.
कुछ पता नहीं. सब mixed. सब confusion है यहाँ.
When you have people who have more moderate to severe depression, you'll find that usually either they speak less, so a person is just sitting, they don't have spontaneous speech. Like many of us speak spontaneously. You know, somebody says, oh, hi, hello, how are you? Somebody comes into your room, you say, good morning. They will not have a very spontaneous speech. They'll sit there, they're usually reserved, quiet. And then when they do speak, the speak is quite monotonous. It'll be at times hypophonic. Hypophonic means the volume of the speech is very low. So sometimes they're speaking very slowly, mumbling. It's hard to understand them. So depression, especially when you have major depression, the speech pattern will change.
Scientists are using artificial intelligence to analyze speech patterns, studying pitch, rhythm, pauses, and fluency to detect early signs of depression, making speech analysis an assistive tool.
Usually you don't do blood tests or MRIs to make a diagnosis of depression. But let's assume we are able to recognize specific speech patterns, and we are able to identify a speech pattern which we feel the research shows that it really is able to diagnose depression with a good amount of certainty. Then I think that will be very helpful. Like you said, it will help to, along with the clinical history, the examination, it will help the psychiatrist, the neurologist, the psychologist to confirm the diagnosis of depression.
Artificial intelligence-based speech analysis can identify depression with up to 75% accuracy. 264 million people all over the world suffer from depression. In India alone, by various estimates, it is being said that about 40 to 45 million people suffer from depression, which is 1 in every 20 people. Hence, early detection is absolutely imperative.
With the help of the speech pattern, the doctor can identify the depression earlier with more sensitivity. That means you are more sure this is depression, this is not something else. Because please remember, speech patterns can change in many other neurological disorders. And if that indeed is true, then early diagnosis will lead to early treatment, whether with antidepressant or psychotherapy, and a better quality of life for the patient and the family.
Speech-based screening could provide a non-invasive, objective tool to flag potential issues earlier than traditional symptom-based questionnaires. From that point of view, the latest study by All India Institute of Medical Sciences becomes very significant. That brings us to the end of this edition of Health 360. We hope you enjoyed watching the show as much as we did, putting it together for you. You can find all these reports and much more up on our website. It's indiatoday.in. You can download the app. These reports are carried on our social media platforms. It's YouTube, Instagram, Twitter or X and Facebook. Our hashtag is Health 360, Health 360 Plus. Do not forget to like, subscribe and share. Until next time, take very good care of yourself. Thank you for watching. Bye for now.